Plenty of health headlines to talk about, including the end of the COVID-19 national emergency. This is Dr. Jeff Potoff. He always joins us on Tuesdays from UW Health. Appreciate your time. So let's begin there, doctor. What does it mean to us that the emergency is now over?
I think there's a few things that it means. One, it means we're in a much better position than we were, really any other time during the pandemic. I think for the everyday person, what it means is things could cost a little bit more or be a little bit less convenient. When we had the emergency order, a lot of COVID-related care, whether it was testing, vaccines, therapeutics, it was all subsidized. You didn't have to worry about it. Now you have to pay a little bit closer attention. Can I go get tested at this spot because my insurer will pay for it, or will they not? Can I get a vaccine for free? If you're insured, that's likely true. If you're uninsured, maybe not. Therapeutics, am I on the hook for that? How much is it going to cost me? Kind of all those questions you ask about other aspects of healthcare are now pertinent for COVID-19 care too.
Yeah, so for a lot of the things, it's kind of up to us, right? It's up to your health insurance. In some cases, COVID tests are being still picked up by their state if you know where to look, but you're going to have to do some research here.
Yeah, absolutely. There still are a lot of free tests out there. So I think for the time being, folks will be able to find tests for free. But like you said, do your research just like you would with any other kind of medical condition to see, what's your financial liability if you get treatment, testing, things like that.
One of the good things to come out of the pandemic was the rise of telemedicine. It existed before the pandemic, but now pretty much everybody's got it. When should we be using these services compared to going in person to see our doctor?
This is a great question because I feel like telemedicine services are a bit underutilized. So in instances where that physician can just see you on the phone or on the video, this can be really helpful. It saves you a drive. It saves you the waiting. Right now, urgent cares, emergency departments, all very busy, and you can often get your prescription. So for common complaints that folks have, ear pain, maybe some urinary symptoms, wondering do I need to go to emergency department or not? Sometimes these teleservices can be great. Unfortunately, if you require an injection or someone needs to do a test to you, they're not as good in that regard, but they can replace a lot of visits.
And this seems to be one of the few things in the world of medicine that drives costs down. I check the prices of things because I got an HSA account. And, a telehealth, that costs less, right?
Absolutely. There is not the huge overhead of a hospital or a clinic. It's just the technology package. Oftentimes, they don't require as robust diagnostics and things like that. So the cost to the average person is actually quite a bit lower to have a telehealth appointment than to go in person.
Not a lot of time here today, but with the weather being so unreal, I'm seeing flowers in my yard, but it means allergy season is back, and there's new studies that's saying our allergy seasons are getting worse and longer. What's going on?
Absolutely. If people think allergy season's getting worse, it's not in their head. It's absolutely true. So since the 1990s, we've seen a couple things. We've seen warmer temperatures as part of global warming. And what that's done is the allergy season has started 20 days earlier, and it extends 10 days later into the fall. And then likewise, carbon dioxide levels are up, which plants love. They create more pollen. We're seeing up to 20% more pollen. So if you feel like allergies are worse nowadays than they were, 20 years ago, you're absolutely right.
I took a Zyrtec today. Dr. Jeff Potoff, appreciate your time from UW Health.